let's get into it and try and you motivate us. So when I listen to Sickle Cell Shujaas, I hear the same pain we face in hemophilia: delayed diagnosis, stigma, unaffordable treatment, and it's like we're fighting the same storm, just from different corners. Today on the Voices of Shujaas, we're hosting Eunice Owino, a Sickle Cell Shujaa, founder of Sickle Cell Uhuru Trust, and one of the most consistent voices pushing for dignity, access, and liberation for sickle cell communities across Kenya. So kindly introduce yourself, Shujaa.
Thank you so much, Pius. Yes, Pius. As you've heard, my name is Eunice Owino. I'm a sickle cell warrior. Been living with sickle cell for the past 4 decades. I'm not ashamed to say my age. I'm 44. Living positively with sickle cell, and the journey has been nice. It has its ups and downs, but again, you see the positive thing that you have to go through. The question I always ask myself, should I say that my glass is either half full or half empty? So how do you see life? So for me, I usually see my glass as half full, not half empty. So that way, every step of my life, I live a day at a time. And one thing that I usually urge people to focus on is loving yourself, because you can only share that love. And then number 2 is have faith, because faith is the key for everything. Because when you have God, God is the finisher and the author of our lives. He's the one who gives us life. Is the one who knows why we go through all these challenges that we were born. But take up your challenges and make them to a positive vibe. So for me, I've always taken sickle cell as one of my testimonies to make me a better person, and also to be the voice of many other voiceless, or people who are ashamed to share their stories, or even just to talk about sickle cell, because some see it as a taboo, others see it as a curse, others see it as you amount to nothing. And then also, depending on what the doctor says, some feel like you won't grow to a certain age, so you can't achieve much. Yeah. But for me, I always say sickle cell is just something that God made me to have, so that I can go through it to make the benefit, to make it look good and give impact to as many people as possible. Because for me, I call it, sickle cell has made me to be a champion and a voice and a warrior to the rest of the community who are ashamed to share their stories. So today I'm happy to share my story with you and your people.
So how did you, from let's say lived experience from diagnosis up to now, Eunice, when did you realize your story wasn't just personal and it was a calling to ignite hope in the now Sickle Cell Uhuru Trust?
So I lost a sister before I was born. And when I lost my sister, by the time I was being born now, because my sister was born in the village. That time my parents were living in the village. So our 3, can I call them like the 3 first children were born in the village. So the rest of us were born in the city. So my parents had moved now to the city, and by the time I was being born, my dad used to work for a research company, the biggest research company in Kenya. So when I was born, he saw I had the same symptoms as the sister I lost. So by the age of 8, they were able to take me in to be tested. And there is where I was diagnosed by sickle cell at the age of 8 months. And I had a very, I always say this, and I know he knows it. I had a very good pediatrician, Professor Francis Nyango. He was the best. We walked that journey. He never told me I could never achieve anything. He was that doctor who used to encourage me, tell me I can do anything, I can face everything. And he helped me to know that I can ask a question. You can ask your doctor's question. Because when I grew up in the 80s, it was so hard to talk to doctors. You will come in and it will be like, I always call it a counseling session, where the doctor asks you, so Pius, how are you feeling today? Then you say, then he writes for you your prescription, the drugs, and then you go home. But no, for me, I was like, I wanted to understand what is going on with me. At the age of 13, I started asking a lot of questions because
Okay.
I was like, how come I'm not as big as my classmates? How come I'm this tiny? How come wind can carry me? How come I can spend 3 months or 2 months in the hospital just being hospitalized because of a sickle cell crisis? Something happens. I remember when I was in class 3, I think at the age of around 9 or 10, I was injected 72 injections. Until today, that doctor usually refused to tell me why. But for me, I believe that was a phase where he was trying to help me because that time there was not so much research around sickle cell.
Yeah.
So we were only put on an anti-malaria drug, folic acid, and a painkiller. So
So
that was it.
it's been quite a journey.
Those,
And
yeah.
you're truly a Shujaa in what you went through. And
Thank you.
diving on the part of the founding Sickle Cell Uhuru Trust, I believe that you pushing for change gets others to feel empowered. So what gap did you see that pushed you to start Sickle Cell Uhuru Trust?
So the gap I saw that helped me or made us to start Sickle Cell Voice Trust was when I joined the Sickle Cell space in terms of doing advocacy. That was 11 years ago. And I remember I saw a huge gap. There was nobody who was caring for the adult warriors because all the doctors were only taking care of the children. So growing up, when you pass your 5th birthday with sickle cell, it was like a celebration. So now we are here, we are in our 30s, 20s, 40s, 50s, 60s, 80s. But for me, I found was how to support the adult warriors. And that's how we ended up forming Sickle Cell Uhuru Trust. And the aim and the missions of Sickle Cell Uhuru Trust is number one, to empower the patients so that these patients can be able to start earning money without being employed, because we all know when you're employed and you're sick, you take your employer's time off when you're sick. Some employers feel that you're wasting their money, you're wasting their resources. So for a sickle cell warrior to be able to hold and take a job, it becomes very hard.
Yeah.
So that's why for me, it's a place of making sure that this adult warrior they have freedom. And that's why the name Uhuru. So Uhuru is a Swahili name that means freedom. So our aim is to give these warriors freedom to be able to be their own bosses, to earn money and live a better life. So for me, I'm still pushing for the warriors to reach a place where they can be their own bosses, earn money, sustain themselves, be able to pay for the health insurance, to be able also to pay for the whatever they need, and also their hospital bills, because once you take care of that, and they always have the medication, and also to encourage them to continue going for checkups, because that also will help you to live longer. So for me, that is the aim and the mission for Sickle Cell Uhuru Trust.
You've mentioned empowerment and motivating others to be health literate, to know more about their health. When now it comes to advocacy, impact, community, what impact are you most proud of, and what impact still keeps you awake at night?
The most impact I'm proud of is mentorship, which I always do for many people. I can see Lynette is here. She's one of the people that I mentor. There are many people I've mentored, and unfortunately, some have passed on, some are still here, and we can continue with the journey. For me, if you have a voice and you need me to assist you, I'll be there. If I'm to refer you as one of the people I'm mentoring, I'll be happy to refer you, because I know the kind of work you're doing. I know your capacity. So the thing of you feeling sorry for yourself, I don't like it. It's called pity party. I don't like pity party. For me, I want you to be that person, be the boss. Because if you're a boss over yourself, we call it being a leader over yourself, so that you can be leader to other people. And then now one day you can be a state leader. So before you start being a leader to others, be a leader for yourself. So that's what I do. And then advocacy, what I'm pushing in advocacy is policies. There are so many policies we need. Because like for me, I still feel that we should not be buying the sickle cell drugs as expensive at the moment the way it's being sold. We need to have like an essential package that will help the sickle cell community to be able to, when you pay your health insurance, the government health insurance, you can be able to get your drugs from there. So that policy is something we're pushing for, and see if you can get that drug from a level 2 hospital as you go up to level 3, level 4 to level 6. So that way, the level 2s are the nearest hospitals near you, depending on which part of the country you are at. It's important to have that in mind. So those are some of the things that I believe even Dr. Sam Bunya will help me to push, because for me, once every system is working, then I'm good to go.
And everything will work as long as we action it, and as long as we have support, we can reach those that we were supposed to reach, and those can even unlock more potential. So when it comes now, caregiver burnout, invisible emotional labor that is being there, it's there in the support system. How do you champion and how do you advocate as a Sickle Cell Uhuru Trust Foundation organization to curb that stigma that we might face in the family?
So for the stigma of the family, I always tell people is be open with your family members. Some families don't talk about health in their families. So they end up losing so many children, of which they could have been saved if you just opened up. Some families have traditions that they follow. So you'll find like a child has been diagnosed with sickle cell, and then the parents will want to take them to the hospital, but because of their beliefs, religion, and culture, you find now they're being taken either to take herbs to a herbalist who will give them some herbs to take, which does not cure sickle cell. Sickle cell is about management, and management should be made and created per patient on what works for that patient. So you as a family, if you discover your child is able to do, or even diet, what are they eating? How can you prevent them from getting crisis all the time? This is way of how they're eating, from the diet, the environment, which is the family environment. So that family environment, the parents are the ones who are supposed to be number one advocate for this child and tell the relatives that this is what's going on with us. You never know, you might, if the whole family does not go to screen, then they'll end up finding children or even grandchildren born with the sickle cell in the future. But do not discriminate to our family because they have children with sickle cell, and then you forget yourself because you don't know if you are the carrier of sickle cell or not. But again, as a family, you need to get tested. So for caregivers, it's the same thing, because what the adult sickle cell patient is going through is the same thing the caregivers are going through. Because caregivers, all the time, you're rushing, you're leaving work, you're rushing to take care of your child. So again, how do we make sure that the caregivers are empowered to a level of being able to also be self-employed, to be able to save lives for children, take care of their children, until now this child is an adult and they can take care of themselves. So again, how do we bring all those family dynamics, faith, religion, and culture together and help them be able to understand the stigma, the myths around the disease? They're the ones who should be talking positive and telling people that's a lie. I have seen, we are the testimonies, and that's why I personally am proud to say my age, because that one will give that person hope that yes, I'll live to this certain age. So all those things, if we continue working and bringing them down to the patient, the caregivers, and also the doctors, the healthcare providers, because also they are one of the most important people that we walk the journey with. They are also supposed to be speaking positive. They should never speak negative about what you're going through. Because if a doctor looks at you and say, hey, this disease is a very bad disease. No, we don't want that. We want positive vibes, give hope, speak life to these children, to their parents, and also as a healthcare provider, tell them, yes, this is the hope, this is how you need to do. And also just having a holistic care, that will be very important to also handle.
That's a great approach, and let's all continue crafting change. And the question is that why are communities facing the same barriers despite different conditions? This needs to go to the systems and from patients to now going to the hospitals. So when it comes to now youth realities, school friendships, and mental breakdowns, what message can you share to those in the schools, those that face stigma in the schools, those that lack knowledge?
For me, I'd say it's more of the way the Bible says, may people perish because lack of knowledge. So in the schools, when you're going through the same thing, when people are showing you discrimination, stigma, that is an opportunity to teach them and educate them about your condition. Because for sickle cell, when you're young and you're experiencing different things going on in your body, sometimes you have yellow eyes. So sometimes the kids will make fun of you that you have yellow eyes. And that's why you can see like the movie that was launched, that was produced some years back, that's called Super Cell. So with the Super Cell, at least it helps you to help educate people. Say, yeah, I have yellow eyes because I have sickle cell, and because of this and this, that's why my eyes are yellow, and that's why I need to hydrate. I need to be drinking a lot of water. I need to take rest. I need to eat at least a balanced diet. So for me, it's when people show you discrimination or stigma, it's a point for you to enter and educate them about your condition. But you also, as a patient, you need to understand what condition are you facing. And this should not only be in schools, we need to do it in communities and also barazas, because there you'll always find the community, because when the community are educated, they're the ones who will help you share and spread what is going through. And this cut across all the non-communicable diseases, because non-communicable diseases are those diseases that are never seen. But sometimes, like a disease like diabetes type 1, they are always injecting themselves with insulin. So when somebody sees you injecting yourself with insulin, they might say you are taking drugs. That's already a discrimination. So it's a way of educating people. And then when your sugars are low, you need to eat something to make sure that your sugars are high. A sickness like hemophilia, you'll see patients, sometimes they look like they're having issues with their legs. So they look like it's a disability. That's how it looks. But how will you care for this patient, for them to feel comfortable, to even come and share with you? So as you step out, you need to be the one who now educates the people. Yes, I'm like this because I have this, and that is not a death sentence. When it comes to a disease like rheumatic heart disease, these are diseases that you can't see. When you see me, you can't see the disease. You don't define me with the disease. So it's a way of you being able to stand out and explain to people, this is what is going on with me. And as part of this disease, this and this is happening to me. So don't feel sorry for me, but I want you to know so that you prevent your child from ever getting this. So how do we, again, what kind of language do we talk to the people who look at you and feel washed? No, we don't want people to feel sorry for us. We want you to take responsibility. For sickle cell, we always call people to know their genotype. Know your genotype so that by the time you're planning to have a child, you are making an informed decision. Know that afterwards, you start feeling sorry for what you have done. Now you have given birth to a child with sickle cell. No, let's walk a journey of being informed, making informed decisions. People need to embrace and understand what kind of conditions you can go through. And today I learned that today is World Disability Day. So again, when you see such policies which were passed before, how is the government taking care of the disability people? How can we also advocate to make sure that government is also taking care of us? Because in our constitution, it says all patients belong to the government. Patients do not belong to organizations. Yes. So the day we understand that, we have policies in government that takes care of us, then we'll be very okay. Because we know very well some European countries, they take care of people who have inherited diseases, disability. The government takes care of you health-wise. and every other thing. I can't wait until the day as Kenya we can be able to reach that place.
So what you're saying is that we need much more awareness when it comes to now youth-led advocacy squads. And you mentioned policy pressure, newborn screening, treatment pathways. How can we better, and in what ways do you think SCOOT can help in that?
That's what we are doing when it comes to policy advocacy. We are doing it as one mother umbrella, which is the Sickle Cell Federation of Kenya. So that is the umbrella that helps all the sickle cell organization groups to be able to understand, be there, and also follow up and see what else do sickle cell patients need. Because the more sickle cell patients grow up, the more we start getting these comorbidities that affect us, like the eye, the legs, going through an AVN session, going through a stroke, going through kidney failures. So for sickle cell, I call it a huge disease that every phase of your life, you go through something. So it's a place where when we speak with one voice, the government hears, and they help us put in place those policies. So as communities, also, we need to learn and know, because right now where we are at, the health is devolved. So somebody like Esther, she's in Busia. I can just tell Esther, go to your governor's office. Tell them you want the sickle cell patients who are living in Bungoma, in Busia, to be given ABCD. Is it happening in other counties? Yes. So she becomes a representative of the Sickle Cell Federation of Kenya in Busia, and she will walk there heads up because she knows the federation got my back. So when you're working with such institutions, then you're placed better, and she knows that these people are following me. She'll have a voice to add to what people want her to do, and also be able to push the policies that needs to be pushed in that county, including even employment.
I second that, and I will hata naweza piga kifua niseme let's advocate for that. So what's the hardest part of your journey, and what can change when it comes now make your life
the hardest part is not is doing advocacy without money.
Okay. So let me open mic for warriors. If anyone in the participants has a question to Esther, feel free to ask.
I think Sam wrote something in the chat. Don't know. You can check it.
There was a message from Sam, but he's already out. So I take this opportunity to thank you're part of experience, you're part of story, and continue creating change. You'll be well. And any last words for the Shujaas and a motivation, maybe?
For me, I'll tell the Sickle Cell warriors and all the Shujaas who are battling any disease, non-communicable diseases you inherited from your parents, live life positively. Live a day at a time. Appreciate God when you wake up. Stop complaining. When I said, how do you see your life? Do you compare your life and say, my glass is half empty? Or do you say your life and say, my life is like that glass, which is half full? So when you live your life like that, then you'll enjoy every single day and appreciate God. Because the Bible says that, why should you worry about tomorrow? God got your back. Because sometimes I picture myself, when you just see simple scriptures in the Bible, you see that he feeds the flying birds in the air. And you're there hustling, thinking, will I ever get money? Will I eat? Will I dress well? When you believe in God, God will always give you healing, because he's the greatest physician ever in this world. And he's the one who is giving the doctors the mind and the brains to be able to get these cures. That's why you can have, like for you who is battling hemophilia, you can always get your factor. And that factor does wonders in your body. And for me, that is like God giving the doctors inspiration to make sure that they get these cures. Because through that, then you're healed. You're okay. And for me, I can't wait one day where we'll be able to find a better cure for everybody who can be able to afford it. Because right now we have different curative cures with sickle cell, the bone marrow transplant, the therapies, gene therapy, and all that therapy. But for me is how can we be able to afford it? Because they're so expensive, you can't afford them. So for me, I can't wait for a day where everything can be affordable for each and every person living with an non-communicable disease or inherited disease or blood disorders, where you can be able to always get your blood when you need it without paying or begging people to assist you. But just also praying for a system that will work and take care of the patients. When we have that, I believe everything will be aligned. And as I always say, love life and live life.
Perfect.
Thank you.
So thank you again for the opportunity. I feel empowered. And you recover well.
Thank you for having me. Thank
You're
you.
welcome.
Hi, Esther. Nice to see you.
Hi. It's long time.
Great.
Yeah.
Thank you so much, Pius. And
Yeah.
see you around.
Looking forward to it.
Okay.
Thank you.